Well, an Indiana tech company and a research powerhouse are combining forces to put health at Hoosiers' fingertips with a new app. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you, Gary. Indiana landed a disappointing 41st on America's Health Rankings report. Becoming a healthier state means more Hoosiers need to get involved. So a new app designed just for Indiana residents aims to make daily health habits a little more fun and interactive. The Indiana Clinical and Translational Sciences Institute and Indianapolis-based tech startup LifeOmic put their heads together to create the free app called Life Extend. Founding director of Indiana CTSI, Dr. Anantha Shaker, and Tom Barber, Chief Scientific Officer at LifeOmic, join me now to tell us about connecting Hoosiers to health a little bit more. Thank you both for being here.
Thank you for having us.
Dr. Shaker, let's start with you. This app is part of the All In for Health program. So tell us first about that program and its aim to get more Hoosiers involved.
Yeah, the All In for Health is a program of the Indiana CTSI, which, as you know, is a partnership between Indiana University, Purdue University, and Notre Dame University. And the concept is that this program engages Hoosiers to take charge of their own health through health applications, learning about health, as well as potential health research that is going on in the state.
And Tom, let's talk a little bit about LifeOmic. It's a software company created by Don Brown. He's an Indiana tech giant, serial entrepreneur. The app, give us a crash course. What is it like for users when they're using it?
Sure. So Life Extend is the name of the application. This is a free app available for iPhones and Androids. And as its name suggests, it's a health and wellness app. And it's different than the thousands of other health and wellness apps out there in 4 key areas: content, socialization, gamification, and data integration. In terms of the content, the principles that are involved there are based in strong science and medical practice and validation. In socialization, we employ the same types of techniques that are used with Facebook friends, for example, so that individuals can create circles within their own network or join other circles of family and friends, and that helps motivate them and encourage them to engage in those practices. Gamification, when an individual does a healthy behavior, it does something like eat their broccoli or rest a certain amount or get a certain number of exercise, they get points for that. They're rewarded, and people are competitive by nature, and they like to see progress, and so we provide those types of measures and instant feedback for them. And lastly, data integration. The app itself is integrated fully into our Precision Health Cloud platform, and that allows other information, clinical data, genomic data, to be brought together to customize that content for those users.
And Dr. Shaker, one important piece of this is giving Hoosiers a chance to get involved in health research. So tell us about how that connects to clinical trials.
Yeah, so one of the unique aspects of this app is, in addition to all the things that Tom mentioned about taking care of your own health, you also have connectivity to all of the research that is going on at the Indiana University School of Medicine and across the state. On an average year, we have about 1,600 clinical research projects that are going on here in all areas, from diabetes to cancer to children's diseases. So we would like people to know about them, participate in them, as well as learn about all the opportunities here.
And really make it more accessible.
Absolutely, absolutely. I think clinical trials is a way to actually access cutting-edge treatments that are no-cost treatments as well for various life-threatening illnesses.
And Tom, we have described this as a precision health app, and I think your average person may not understand what that means. So can you explain what that means in layman's terms?
Sure. So no two people are the same, and no two people need to follow the exact same practices in order to have a healthy lifestyle. So by bringing together the information from the mobile application with the individual's clinical data from their electronic medical record, for example, or with their genomic data if they've had different genetic tests done, the type of activities that those individuals can employ are customized really to themselves and to their specific needs.
Yeah. Absolutely.
And so you could have used a lot of different tools to connect with Hoosiers. So why an app in particular? Probably either one of you could speak to that.
Yeah, no, I think the way to connect with people anymore is through social media, and these devices, especially phones, smartphones, is universally available. People spend a lot of time on that. People connect with a lot of their family and friends through those. So that's a perfect vehicle for us to reach and engage Hoosiers in healthy behaviors.
And again, for either one of you, the future of this, where do you go with this app down the road?
I would say we want to engage as many people as we can. Our goals currently are to get 100,000 people over the next 2 years. But eventually, we would like to connect all 6 million Hoosiers through this and other apps for healthy behaviors.
All right. Well, Dr. Shaker, Tom, thank you both for being here today. Hopefully, you're both tracking your health on your app.
Yes, absolutely. I got my app.
Eat your broccoli.
Thank you.
Gary, back to you.